So most people have at least heard the term cataracts. However, even if they've heard the term cataracts, they don't know exactly what a cataract is. And if they know what a cataract is, they don't know how they develop or how they affect our vision. Well, in this video, we're covering all of that, as well as some bonus tips toward the end on what you can do to prevent them. So let's take a look. Hey everyone, welcome to Doctoreyehealth, the place where you can come for the best tips and education about your eyes and your vision. And if this is the first time that you and I are meeting, I am Dr. Joseph Allen. I'm a practicing optometrist here in the state of Minnesota, and this channel I get to do vision product reviews as well as educational material about the eye disease as well as our eyesight. So thank you and welcome to the channel. And hey, at any point throughout the video, make sure to check out the show notes and links below for additional information about anything that we covered today. Otherwise, let's get in deep about cataracts. Now, since we're talking about eye disease and we're in the clinic, let me change into my white coat. All right, now that we have the threads on, we can go over exactly what a cataract is. And to do that, let's look at some anatomy. Now, if we quickly go over the structures of the eye, the front part is the cornea. That's where we have contact lenses sit. That's where we do LASIK eye surgery, is right on the cornea. Behind the cornea, we have the iris, the colored part of the eye. Behind the iris, we have the crystalline lens, which helps light focus to the retina in the back of the eye here, which picks up the signals of light and sends that back to the brain to let you see. Now, the big thing we're focusing on today is the crystalline lens that sits inside the eye. This is where a lot of the magic happens. When we're young, this lens remains clear, thin, and flexible, and allows us to focus on objects in the distance as well as up close. But as we get older, this lens becomes thick and rigid and makes it difficult for us to focus on things up close, causing us to need things like bifocals. But as we continue to age, this lens actually begins to change color and becomes fogged over and opaque, and it becomes hard to see through. And that's what we call a cataract. Now, there are actually many different types of cataracts. We have nuclear cataract, cortical cataract, posterior subcapsular cataracts, Christmas tree cataracts, diabetic cataracts, just to name a few. Now, there are different causes for cataracts. Be born with them, again, in a congenital cataract. People can develop them due to medication use, or perhaps you've had trauma or other eye surgeries that can cause a cataract to develop. And some conditions like diabetes, which actually puts people at a much higher risk of developing cataracts, almost up to 25% higher risk versus somebody who doesn't have diabetes. Now, the honest truth is that if you were born with a crystalline lens and you get past around the age of 50, everybody develops some form of age-related cataract. It's just part of the aging process, kind of like getting gray hair. You know how if you leave metal outside, it'll eventually rust, or if you take a bite of an apple and leave it on the counter, it begins to turn yellow and brown? That's called oxidization, and that same process is what causes an age-related cataract. As we get older and approach around the age of 50, the lens inside the eye actually starts to go through that oxidation process and begins to turn yellow and eventually brown. And as that part of the lens turns color, it actually becomes opaque and harder to see through. Now, there are different types of age-related cataracts. The cataracts can form in the nucleus of the very center cells of the lens. It can form in the cortex, the outer edges of the lens, and then it could even form on the capsule, which is kind of the candy coating of the M&M. You can sort of think of it that way, on the outside shell of the lens. Now, the nuclear type of cataract is usually the one that turns the yellow and brown color, and that's the very center of the lens. There's the cortical cataract, which starts in the cortex, and that kind of looks like these little spiky edges coming in from the side. And if those spikes hit the very center of the lens, you can't see much after that. And then the capsular cataract, which is pretty rare, it only affects about 10% of the population, and that's caused by cells that swell on the surface of the back of the lens, and that causes a very rapid change and loss of vision. Now, usually this process of developing cataracts is a very slow change, and it's so slow that a lot of times you don't even realize that it's happening. A lot of times people just come in to have the routine eye exam and suddenly the doctor's telling them, well, you can't quite see 20/20 anymore, even with glasses, because you have a cataract. And it's pretty easy to imagine vision changing with cataracts, kind of like looking through a clear window that gradually becomes kind of a fogged glass window. Not only does your vision become blurry and out of focus, but then light actually scatters and causes more problems with bright lights, things like headlights, and that's one of the reasons why we all have trouble driving at nighttime as we get older. Because that cataract causes light to scatter, giving us a lot of glare, and it's hard to really pick up small details. Another way that cataracts affects vision is with color, because the cataract turns yellow and eventually a brown color, and that filters out blue light. And so many people start to have trouble picking up the differences between blues, blacks, and other dark hues of the spectrum. Sometimes I'll be able to tell if a patient has cataracts just by them walking into the office because they have one blue sock on and one black sock on. Yes, I notice those sort of things. So did you know that eye diseases such as cataracts have actually influenced famous artists throughout all of history? Paintings by Picasso and more famously Monet's Blue Period may have been partly developed because of their inability to perceive blue color tones, requiring them to use darker and darker shades of blue in their paintings. And hey, if you're an artist yourself and you feel that your work has been affected by your vision in some way, make sure to comment in the section below. I'd love to hear about your experience. Now, my favorite way to evaluate a patient for cataracts is utilizing what's called a slit lamp. A slit lamp allows me to get a really high definition view of the cataract inside the eye. I can actually crank the magnification up to over 25 times, and that gives me a really high definition view of which part of the lens is changing and responsible for that person's vision. Now, as somebody develops cataracts, in the very early stages, it may not affect vision very much at all, and that person may continue to do well with just glasses, contact lenses, or maybe want to consider a surgical correction. However, as cataracts develop and get more dense, it eventually affects vision to a point where glasses, contact lenses, nothing else is going to help them see better except for cataract surgery. Now, we don't really have enough time in this video to cover everything about cataract surgery, but in short, it's an operation where they remove the cataract from inside the eye by breaking it up into tiny little pieces. They remove it and then they put a new plastic lens in its place and allows you to see clearly again. And the procedure usually only takes about 15 to 20 minutes. It's very successful and one of my favorite things to recommend patients for. And what's really cool is that the implant that they put inside the eye can accommodate for your prescription and get you to see almost without even needing glasses at all, except for maybe just reading glasses. And when I finish my review of cataract surgery, I'll hook you up with an extra YouTube card up above, as well as in the description below, so make sure to check that out in the future. So a lot of people, after I tell them they have cataracts, they want to know what they can do to slow down or prevent the development of cataracts. And there's actually a couple of things you can do. Now, the number one way you can reduce your chance of developing a cataract is to reduce that development of oxidation. And you can do that by eating very healthy. Lots of fruits and vegetables. Those antioxidants and minerals that you get in those foods are going to help slow down that whole oxidative process. In particular, vitamin C is an antioxidant in a very high concentration within the eye and is believed to help slow down cataracts to some degree. The second pro tip to slow down development of cataracts is to wear sunglasses when you're outside. Sunglasses actually filter out harmful UV radiation light that we get from the sun, and they actually have done studies to find that people who are fishermen or spend a lot of time on the water, they're more likely to develop cataracts at a faster rate because that UV light comes down, hits the water, bounces up, and then hits them twice, again causing that cataract to develop faster. And if you're not too sure what type of sunglasses you should be wearing, I'll hook that up in the YouTube card up above, as well as in the description below. An additional thing you can do to help reduce the development of cataracts beyond just sunglasses is wear a wide-brimmed hat to protect your eyes from that UV light radiation. And tip number 3 is ultimately to go in and see your eye doctor, get the evaluation, figure out if you have cataracts or if you're at risk of developing even a worsening cataract, and listen to what they have to say and recommendations for you and your prescription. Ultimately, every doctor took an oath, just as I did, to give you the best in care and treatment for your eyes, so listen to what they have to say and your treatment options. So question of the day, have you or any of your friends or family been diagnosed with a cataract? Make sure to comment in the section below, let us know kind of your experience. Happy to get back to you guys. Otherwise, that's the whole video for cataracts. Make sure to hit that like and subscribe and share button to share it with friends and family who may be interested in learning more about what a cataract is. Otherwise, again, this is Dr. Joseph Allen from Doctoreyehealth, bringing you the very best in tips and education about your eyes and your vision. Keep an eye on it. We'll talk to you soon. Beep. Just to name a few. Just to name a few. Just to name a few.